Josh Hoffman. Today I will be answering the first question regarding the National Practitioner Data Bank. So this is a website collection of reports of medical malpractice payments. It was established by Congress to prevent NPs from moving state to state without disclosing previous malpractice. The information is confidential and the public cannot access it at this time. To provide it to the public would, however, increase transcrepancy of the providers. They could determine, or a patient could determine, hey, Dr. X has a lot of claims on this total hip. I don't want to see him for a total hip, and patients may be more inclined to see another provider. For an educational standpoint, someone could, maybe track to see why is there so many malpractice claims for a certain procedure, and to find some shortcomings of the current practice guidelines and prevent further injury to patients at a later date. However, on the other hand, some cons could include the information may not be complete about the providers. So I have a reference that I'll link below under my discussion that highlights that Part 2 of this data bank may have programs with a hospital which include like early resolution if an apology is made, and subsequently these claims are then never submitted to the data bank. So by releasing it to the public, people might not be getting the full picture of it. Additionally, studies have shown that there's little connection between negligence and filed malpractice claims. An example would be a person with very poor dentition comes in for a procedure that they have to receive MAC, and they end up losing a tooth over it. If this claim proceeds, the CRNA is then entered into the data bank. Personally, I feel there's good and bad to the data bank. It helps prevent hospitals from hiring repeat offenders. However, I don't think it should be revealed to the general public just because the previously discussed case study say this person's tooth needed to be removed 5 years ago and it's coming in, and he gets intubated and he loses it and there's a claim. Well, that's just my overall thoughts. I look forward to listening and hearing from my fellow classmates this week. I hope everyone has a good week. Thank you for listening.